Thanks so much, Lou. I'm so excited to be here with you. We used to joke that the only time Lou and I would see each other is when we were out of Chicago at a dental meeting somewhere else in the world, right? That was the only time we ever saw each other. We live about 5 miles from each other. Right back at you. Sure, Lou. When this all started, I know that I started speaking to a number of dentists, most of whom are younger than me. And some of them hadn't even been in practice as an owner as recently as 2008. So for people like you and me, Lou, who have lived through when the financial meltdown happened in 98 and then 2000 and the tech bubble burst and then 9/11 and then the 2008 significant financial meltdown, I think those of us in our age group were a little bit more mentally prepared for what was happening, whereas the younger dentists, not so much. And what I'm finding as I talk to more and more dentists is that there are really 3 different areas that they're feeling the most challenge. The first is an actual physical challenge. With the additional PPE that everybody is required to wear, it is, a lot of them tell me it's very hot, it is really tiresome by the end of the day. And having such a challenge with communication with their team and their patients, because many of them are wearing the N95 mask and the surgical mask over that, and a face shield and a head covering and a gown. And so now think about how much of our communication is really by body language and by tone. And so it's really important for doctors and their teams to be very aware of the fact that their words may be garbled through all this additional PPE. And so being super conscientious about having a gentle and comforting and confident tone with their patients, and also using body language a little bit better, making sure they're keeping an open body language when they talk to their patients, especially about anything that might be a concern for the patients, is more important than ever. That's a great question, Lou. Yes, I am. I've been telling clients that for many years as dentists, we have kind of rolled in what our infection control costs are into our regular fees. As we all know now, those fees are quite onerous. There are a number of different levels of what the doctors need to commit to make their patients and their team and themselves feel comfortable and safe. And since insurance companies are across the board not reimbursing for that, it is something that is going to be an ongoing and possibly onerous cost. And I don't think there's anything wrong with a dental practice charging for that. I was out for dinner a few nights ago, and at the restaurant, there was a 4% PPE fee, because they have to clean the tables more, they have to turn over differently. They have a lot of other additional costs that don't go into producing revenue. And a dental business is no different from any other business. And in fact, even though we have always been at the forefront of providing the most high-level infection control for our patients, it is now at a whole different level. And there's no reason why the teams should be forced to take that on. You mean fear from the dentist or fear from the patients? Oh, fee. I'm sorry. I thought you said fear. and I couldn't see your facial expression. So it's varying greatly depending upon the area of the country. Around here, it seems like most offices are charging around 20 to 30 per patient, and some in California are charging as much as 50, because California tends to have a ton more regulations than almost anywhere else. Absolutely pivotal. That old saying that a picture is worth 1,000 words is more true than ever. And even if the patient can't 100% understand your words through your double mask, if you're showing them on your computer screen some huge blow up of a broken tooth that they didn't know was there, then they can immediately make that connection that, oh yeah, Dr. Graham's right, I do need a crown on that tooth. So yes, it makes communication much easier. Sure. Well, the first one is making sure that they're invested in their team. We know that no dentist can run a successful practice alone. And those dentists that have previously invested a lot of time and money into getting their team as cross-trained as possible, as comfortable with communication, and being able to do sourcing and accountability with your team, where you basically have a middle management within your practice, where there's one individual who is each responsible for the 3 departments within the dental practice, which would be operative and clinical, hygiene, and then administrative, and then the 3 areas of accelerators, which is your marketing, new patients, and then hygiene reactivation and treatment reactivation. And so if each sourcing person is in charge of those departments, it doesn't mean that they're responsible to do every single thing related to that. They are accountable for the results, and then they work with their particular team within the practice to ensure that all of these systems are constantly being taken care of. And now, especially, I know that a lot of dentists are feeling, gee, I'm so busy because I was so backed up from all the months that we were closed. I can't even begin to worry about reactivating hygiene patients. And I say, it's like marketing. Don't shut your marketing off because you're busy. You need to make sure that those systems are in place on a regular basis so that you can continue to feed your pipeline. And you don't know coming down the road where there are a number of opportunities out there, which is the other thing that we're stressing to our clients and dentists across the country. I know that it's easy to focus on the risks involved with this situation. But if you're thinking about, gee, I really thought that I wanted to build my practice up in the next 5 years. Well, you may have some amazing opportunities right now. You might be able to merge with another colleague who has a similar mindset, similar ethics, and wants to run the same kind of practice as you. And within a very short period of time, you may be looking at doubling your patient base. You may be looking at acquiring practices from dentists that are in like your age group and my age group, Lou. Perhaps there are guys that wanted to practice for 5 or 10 years and owned their business and they were doing fine, and then COVID hit and they decided one of 2 things: either I still want to practice, but I don't want to run the business as much, and I want to step back a little, but I want to keep my fingers wet. So that's a great person to partner with to acquire that practice and basically buy them out over time. Or there are other dentists who just say, you know what, I'm done. And so there are a lot of opportunities out there for the dentists that are really taking advantage of looking ahead and not letting themselves get mired in the misery, as I say. Yep. Well, the dentist, first and foremost, really should be sitting down and thinking about where do they want their life and their practice to be in 1 year, 3 year, 5 years, 10 years. And I know that that's different for a lot of us because, like you, Lou, I was lucky really early in my career. I had some amazing mentors, and I got hooked up with a fantastic coach very early in my career. And I know there is no way that I would have done the things that I did if I didn't have her for support. And the support team, besides just your coach or your consultant, the other thing I always stress is make sure you've got a great support team of your other professionals, like your accountant, your attorney, your HR specialist, your financial planner, your banker, your wealth manager, because all of those together should be working really as a mastermind group to help the dentist be able to get their practice so it's a self-sustaining business that's really run by a well-run team that takes ownership in the practice. And then the dentist can go in and do what only the dentist can do, which is do great dentistry. And so once the dentist, a lot of times when people ask me, what's my ideal client? I usually say someone who's been out for about 5 to 10 years. Because do you agree, Lou, that at that point, we kind of had our clinical skills in hand. We kind of had already figured out which direction within general dentistry we wanted to go. And for those of us that had a grander scheme in mind, that was when we realized, whoa, I really don't know anything about being a great leader, being the CEO of my business, and how to communicate effectively with other people. Because those are the 3 things we're not taught in dental school. And you know that you have to have those skills if you want to be a successful leader of your dental practice, right? Yeah. Mm-hmm. Yep. Abs- Absolutely. And I always say to dentists when they ask me, well, why would I need a coach? And I always say, well, Tom Brady has a coach. Tiger Woods has a coach. I mean, both of them have multiple coaches, right? Michael Jordan had a coach. Wayne Gretzky had a coach. Anybody that hits the level of beyond excellent within their profession has a coach, because those people realize their job is just to get their skill as ideal as possible. And there are others that know more and also have a very different outlook about what are the factors going into why you're in the place that you're in right now. And even if that's a good place, it doesn't mean that you can't be in a great place. And it is nearly impossible for one dentist working full-time, running their own practice, to be able to sit back and be able to really objectively look at, how's my team working? How's my marketing working? You know, what are we doing for new patients? What are all my systems in place? Do I have the best software available? What other technology do I need to get into the office? Because as dentists, we want a cookbook, right, Lou? We work best by that, because success within our clinical practice means that we have certain steps that we have to follow in a certain order. And I don't know if we're pre-programmed, and that's why we love dentistry, or we become even more automated because of that. And because there is no cookbook on how to run and build a successful business, because every practice is different. And a really good coach starts with the doctor's vision for his or her practice. What do you want this to look like, feel like, smell like when a new patient walks in? What kind of dentistry do you want to do? What do you want your team to look like? How much do you want to work? How much money do you want to make? When do you want to retire? So all those things go into building the vision of the practice. And then the second part that's so important is getting the team on board, ensuring that the team that's with the doctor is as bought into the vision of the practice as the doctor is, setting up operating agreements to make sure that everybody has a code of conduct that they share, and that no one person is responsible for everything. Each person is responsible for his or her own behavior, and the team will be there to make sure that you're staying on track. Because anyone that's ever played a team sport knows that, yeah, the quarterback may get all the glory, but he can't do anything if his wide receivers don't trust him. And he can't do anything if his defense isn't there to make sure he doesn't get kicked on his butt every single time he's got the ball. So it's very similar. Yeah. Or you're lying. Yeah, you're right, Lou. And I have often said that a really good coach is your cheerleader when you need it, and they're also going to kick you in your butt when you need it. Because as someone who's also worked with a coach, right, we know, Lou, I would say 85% of the challenges in a dental practice start where? Right with the leader, right? We have to take a hard look in the mirror and realize, whoa, that old thing about what's the definition of insanity, keep doing the same thing and expect a different result. And plenty of doctors will come up to me and say, hey, I kind of know all this. And I say, that's awesome. Are you doing it every day? And usually I get, well, and I say, listen, I totally get it. I had my fingers, deep into someone's mouth for 9 hours a day, 4 days a week. I made myself go in the office on Fridays. But the reality is, at that point, I was only working on the business. I wasn't working on being a leader for my team. Because if my team wasn't there and I wasn't taking that time to train them on verbal skills, on customer service, on communication, then I was still only doing 2/3 of my job, right? Yeah. That's a great question, Lou. So one of the first things that we always ask a potential client is, tell me, doctor, where are you now? How did you get here? Where do you want to go? Do you have a game plan? And how can I help? Because the doctor needs to at least have a clue about where they are and where they want to go. So it's important for them to ask a potential coach. First off, I think it's really important to have great rapport with your coach. There are a number of programs out there, and let's face it, a lot of the things are basically the same. At Fortune, we're not teaching anything dramatically different about how to schedule to goal. I mean, that is a system. It's more a matter of making sure that you are simpatico with your coach, that it's someone that you trust to be able to, when you, as we say, open your kimono, we're not going to laugh. We're going to be there to say, listen, I got the same issues, and here's how I can help you. You need to tell me the 3 things that are challenging you the most right now. And as you know, Lou, those 3 things are usually multifactorial. So they may say, I can't close enough cases. Well, we know that it's not only because the doctor isn't presenting treatment. It may be that the hygienist isn't supporting them during the hygiene visit. Maybe their financial coordinator isn't giving the patient options on ways to afford treatment. Maybe the scheduling coordinator isn't making sure that the patient can be seen in a timely manner, or it may very well be that the doctor's just not presenting enough treatment. But we know that there are 10 different things that go usually into one issue. And so a good coach is able to, within just a few minutes of really talking to a client, because all of our problems are all the same, aren't they? They're just to different degrees. It's not like there's any dental practice out there now that's dealing with, something that is so unique that no other dental practice has ever encountered in the past 100 years. So it's really a matter of making sure that your coach is listening to you. A really good coach asks a lot of questions. And so when the doctor asks me questions, I usually am asking them questions back because I want to delve deeper to really see what their pain points are, so that I can ensure that when we start to formulate a treatment plan together, a game plan for how to improve their practice and their life, that I am addressing what's most important to them. We don't have any set agenda. It is, here's what we want to be able to do based on what you told me your 3 big issues are. So within 3 to 6 months, my goal is to get this checked off. And when we get this checked off, you're going to actually be happily surprised that these 3 other things also went away that maybe you weren't even thinking about, but that were vitally important as to the final result of your one main challenge. Woo! I would love to. Thanks so much for having me, Lou. It was really fantastic. Take good care. Bye-bye.